Hey guys, my name is Ralph Abelineda and today I'm going to show you on how to do abdominal assessment. So before we are going to assess the client, first we need to review his or her medical records, if any, and then determine the scope of the assessment and prepare the necessary equipments like a stethoscope, a gloves if necessary, and a ruler or measuring tape or any kind of measuring material. And then third is we need to perform the hand washing. So in the introductory phase, we need to greet the client politely and then ask his or her name and his or her age, and then also ask the client on how he or she would like to be called in the assessment, and then ensure the safety of the room for the client, and then explain the procedure to the client and how he or she can participate in the assessment, and then also ask if the client's bladder is empty, ask him or her if she peed.
Morning, ma'am. My name is Ralph Abelineda. I'm a student nurse from the Doctors College. Ma'am, may I confirm your name, ma'am?
April.
April, okay, ma'am. Your age, ma'am, or your birthday?
24 April 27.
27. Okay, ma'am. So, today, ma'am, we are going to do an abdominal assessment. Okay, ma'am, you can ask questions whenever you like, ma'am, as for participation in the assessment, ma'am. So, ma'am, as you can see, ma'am, we are in a closed environment. We are in a private section, ma'am. So, nothing will come out of this room, ma'am. So, ma'am, are you okay with the temperature, ma'am?
Yeah.
Ma'am, before we start the assessment, ma'am, nangihi na ka, ma'am?
Yes.
Okay, perfect. Now, so, let's start na, ma'am.
So the first thing we're going to do is to inspect the abdomen. The first thing we're going to do is to check for abdominal skin characteristics. Next is we're going to check the umbilical and check for check for bulges and mass. And then we're going also to check the contour and symmetry. And then we're going to measure the abdominal girth. And then lastly, we're going to observe for the abdominal movements.
So, may I, ma'am, that you put this blanket in your waistline, ma'am. Okay. And then, ma'am, may you raise your shirt in the rib level, ma'am. Okay, ma'am. So, now I will inspect, ma'am, and assess the skin temperature. Okay, the skin is fair. Okay. Match, ma'am. Very ticklish, ma'am.
Yes.
Okay. I will try your best, ma'am, not to move. Okay, skin temperature is good. And okay, the umbilicus, no bulges or mass. Okay, symmetry. Okay, good. I'll start it here. Now, I will measure the abdominal girth, ma'am. Excuse the meter stick because we are short on supply today. Okay, now we observe for abdominal movements. None so far that I can see. Okay, ma'am. So let us now move on to the next phase.
So the next thing we're going to do is auscultation. The first thing we're going to do is to ask the client's last intake, and then the next thing we're going to do is to auscultate the 4 quadrants of the client's body, starting from the right lower quadrant, and then move in a clockwise direction. And then the next thing we're going to do is to listen for vascular sounds. We're going to use the bell for this one because the bell is used to capture low pitched sounds. And then in the peritoneal part, we're going to use the diaphragm because the diaphragm captures high pitched sounds.
So now I will auscultate your abdomen, ma'am. Please try and be calm, ma'am.
Ma'am, I will exercise extreme caution for you to be not quick. Okay? Just breathe.
Okay, ma'am. Now that's done, ma'am. We're going to move to the next phase, ma'am.
So the next thing we're going to do is percussion. We're going to percuss the abdominal tone, which is to percuss several areas in the 4 quadrants of the client's body, and we're going to check for tympani and dullness. The next thing we're going to do is to do vertical liver span. We're going to start at the lower border, and then we're going to start in the right lower quadrant, and then percussing upwards. And then in the next thing we're going to do is to percuss the upper border, which is to percuss downwards. And then check or measure the distance between the 2 points. The next thing we're going to do is to do vertical liver span at mid-sternal line. Like the mid-clavicular, we're going to start at the lower border, except we're going to percuss at the umbilicus, and then we're going to do an upward, and then the upper border, we're going to percuss downward at the at the body of the sternum at the third intercostal space. And then after that, after the percussion, we're going to measure the distance between the 2 points.
So I'm going to start percussing, ma'am. Okay? Can you please put your hands aside, ma'am, and be relaxed. I'm going to mark this, ma'am. Okay? Okay. Stop here, ma'am. Mark this also, ma'am. Now I am going to measure. It's about 10 centimeters. Okay. That's good. I'll try to do this time. ma'am. So let's go to next.
So the next thing we're going to do is we're going to do liver descent. Basically, we're going to ask the patient to breathe and hold it in, and then we're going to percuss at starting at the right lower quadrant, at the mid-clavicular line, going towards the liver, and then we ask the patient to exhale, and then measure the distance of the lower border liver dullness.
Okay, ma'am. So I will still percuss, ma'am, but I need you to ma'am, to inhale and hold your breath. Okay. Put your arms on the side, ma'am. Okay, ma'am. So inhale, ma'am, and hold. Okay. So ma'am, exhale.
So the next thing we're going to do is to percuss the spleen. First thing we're going to do is to position the client at a right side lying position. Flex the left knee and identify the left anterior axillary line, and we're going to assess the sides of the spleen, and then we're going to check for splenic percussion sign.
Okay, ma'am. So I need you to ma'am, to lie on the right side, ma'am. Yeah, here. Okay. Okay, ma'am. So can you do your left ma'am, like this? Flex it. Okay. Okay, it's good. Okay, ma'am, can you take a deep breath, ma'am? And then release. Okay, ma'am. Take a deep breath again, ma'am. And then release, ma'am. Okay. We're going to move on to the next test.
So the next thing we're going to do is liver blunt percussion. So basically, we're putting our left hand at the lower right anterior rib cage, and then strike it with the ulnar side of our fist, and then ask for any pain. Next thing we're going to do is to do the kidney punch. So basically, we're going to let the client sit, and then place our left hand in the costovertebral angle over the 12th rib, and then strike it in the ulnar side of our right arm, and then ask for any pain.
So I need you to, ma'am, to lie in bed again, ma'am. Normal position. Okay, ma'am. So raise your shirt, ma'am. Okay. So, ma'am, I am going to do a liver blunt, ma'am, percussion. So, ma'am, just relax. Okay.
Tell me if there's any pain, ma'am.
You feel any pain?
Just ticklish, okay?
Okay, ma'am. So I may request ma'am to be good, ma'am. Okay. So ma'am, I will raise your back, ma'am.
so just relax, ma'am. And just tell me, ma'am, if there's any pain. May sakit, ma'am?
No.
No. Tatry ko lang. May sakit, ma'am? That's good. Okay, ma'am, so please, ma'am, lie again. The next thing we're going to do is to test for ascites. We're going to test for shifting dullness first. First thing we're going to do is while the client is in a supine position, we're going to percuss the flanks from bed upward toward the umbilicus, and then we're going to reposition the client at the right side lying position, and then percuss again from bed upward, and then after that we're going to do the fluid wave test.
Okay, ma'am. So I'm going to test now for any signs of ascites, ma'am. So raise your shirt again, ma'am. Okay, I'm going to percuss, ma'am.
Still the same, ma'am, just relax. Okay, the percuss here, here to your umbilical. Alright. Okay. Okay, ma'am, can you lay on this side, ma'am? Left side. Okay, ma'am. So,
We're going to palpation now, ma'am, which is the last phase.
So the last phase of the assessment is palpation. We're going to do light palpation, which is to lightly palpate all 4 quadrants or 9 regions, and avoid any areas that that are identified as painful by the patient. And then we're going to do a deep palpation. We're going to deeply palpate using the palmar surface of our hands or the fingers, and then deeply palpate it approximately 5 to 6 centimeters, also avoiding any painful areas that are identified by the patient.
Next thing we're going to do, ma'am, is palpation. Okay, so I'm going to palpate lightly, ma'am. Just like the last one, ma'am, percussing, but I'm going to use light pressure. Okay.
Okay.
So,
Just try to relax, ma'am. Are there any painful areas, ma'am?
No.
Okay, ma'am, so now I'm going to do a deep palpation, ma'am. Okay, just relax. Okay.
I'm going to the next test, ma'am.
So the next thing we're going to do is we're going to palpate the umbilicus and surrounding area. We're going to moderately palpate the umbilical ring, and we're also going to palpate the abdominal aorta. We're going to use our thumb and index finger to deeply palpate the epigastrium.
Okay, ma'am. So I'm going to palpate next year, ma'am, umbilical ring, yung puso mo. Palibot ng puso mo.
Yes, relax, ma'am. Okay, no swelling, no bulges.
Okay. Okay, so we're going to the next test, ma'am. Okay, ma'am, just relax, ma'am. I'm going to do your abdominal layer down. Just relax. Going to the next test, ma'am.
The next thing we're going to palpate is the liver. So we're going to put our left hand at the 11th and 12th rib, and then put the right hand in the same manner in the opposite side, and then we're going to ask the patient to take a deep breath and then push the fingertips upward and inward, or at the lower border of the liver.
Okay, ma'am, so just relax, ma'am. Okay. My hand here and my left hand here. Yeah. Then I'm going to put my right hand here. Okay. Okay, ma'am, so take a deep breath. And then exhale. Exhale. Take a deep breath again, ma'am. Exhale. So we're going to move.
The next thing we're going to do is we're going to palpate the spleen. So we're going to stand at the right side of the client, and then we're going to reach over the abdomen with the left hand in the posterior lower rib, and then place the right hand on the costal margin and pressing towards the spleen. Next is we're going to ask the client to breathe deeply, and then we're going to use the right hand to do inward and upward while the left hand as a support. Next is, if you're done doing that, we are going to start the palpation below the costal margin.
Okay, ma'am, so I need you to reposition yourself, ma'am. I'm lying in the right side. On the right side, ma'am. Okay. Just relax, ma'am. Okay, ma'am, breathe and hold. Okay, release. Move now to the next test.
So the next thing we're going to do is palpate the kidney. So we're going to stand at the right side and put our left hand under the right posterior flank, and then put our right hand on the right costal margin at the MCL. Then instruct the client to take a deep breath and then compress the fingers during peak inspiration, and then ask the client to exhale, and then hold his or her breath for a moment, and then gradually releasing her breath, and then the kidney should slip right to your fingers, and then repeat the process in the left kidney. So in the urinary bladder, we're going to we're going to palpate the symphysis pubis, and then we're going to move upward and outward to estimate the bladder borders.
Okay, ma'am, can you put your hands on the side, ma'am? Okay, so I will now palpate your kidneys. Okay, ma'am, just relax. Put my hand here. Then put my hand here. Okay, ma'am. So, ma'am, breathe deeply.
do the same thing. Okay. Ma'am, breathe. Exhale. Breathe. Exhale. Breathe. Exhale. Breathe. Exhale. And then breathe. Hold. And gradually release the air. Okay. So just relax, ma'am. I'm going to palpate this area, ma'am. Okay. Okay, ma'am. Breathe. Okay. Bladder is there. Okay. Size is normal. Now we're going to test for appendicitis, ma'am. Next is we're going to do test for appendicitis. We're going to do rebound tenderness, referred rebound tenderness, SOA sign, obturator sign, hypersensitivity test, and then we're also going to do the test of Murphy's sign. Okay, ma'am. So I'm going to test for rebound tenderness, ma'am. Which is just report to me if you feel any pain. Okay. Feel any pain, ma'am? No. When I press this, ma'am, in the right lower quadrant, does any pain occur here? Here, here. So, ma'am, I will be going to, ma'am, test for soya sign, ma'am. Okay. Basically, ma'am, I just want you to lie in the left side, ma'am. Okay. Now I am going to raise the right leg, ma'am. Okay. Do you feel any pain, ma'am, here?
No.
In your abdomen, no? Nothing?
No.
Okay, ma'am. So now lie down. Okay. I'm going to do this, ma'am. Basically, we're going to flex your leg, ma'am. Put it here. Okay, ma'am. So do you feel any pain
No.
in the abdomen, ma'am? Okay, ma'am. So now, okay, release your shirt, ma'am. I'm going to test for hypersensitivity, ma'am. So if this irritates you, let me know, ma'am. Oh, this, no, no. So, we're going to the next test now. Okay, ma'am, so the last test we're going to do is we're going to test for Murphy's, eh? Okay? I'm just going to palpate, ma'am, here, area. Just relax, ma'am. Okay. Okay, ma'am. Inhale. And then exhale. Inhale. Exhale. Do you feel any pain, ma'am?
No.
Okay, so negative sign for Murphy sign. Okay, ma'am. So now we're done, ma'am. So I'm just going to discuss my findings, ma'am. Okay? Okay, ma'am. So this is my findings, ma'am, in the abdominal assessment, ma'am. So the abdominal skin is fair, ma'am. Okay, I have seen no stretch. I have not seen stretch marks, scars, or any rashes, ma'am. So that's good. That's normal. And the umbilicus, ma'am, is in the midline. It's perfectly in the middle. And then there's no bulges. And then ma'am, your abdomen, ma'am, is round and ma'am, symmetric with no bulges, so it's normal, ma'am. Okay, and
No pulsations whatsoever that I can see, ma'am, in your abdomen. Peristaltic waves. And in the auscultation, ma'am, there's no growths or friction heard, ma'am. Yung ano. So, in the percussion, ma'am, the tympani and dullness, ma'am, is normal. Over the liver, spleen, and ma'am, the colon and the liver span is 10 centimeters. Here in your mid-clavicular line, and in the mid-sternal line, your ma'am, liver span is 9 centimeters. Okay, so no tenderness with blunt percussion, ma'am, in kidneys or liver, yung ginanon kita, ma'am. Kita sa likod. So, yan, no abdominal tenderness, no rebound tenderness. According to you, wala namang pain na nararamdaman mo. And negative in psoas, obturator, hypersensitivity, and Murphy sign. So these are the last tests, ma'am. Yung nag-ask ako if there is any pain that you can feel. So this is according to you, okay? This is your feeling, okay? So that is my findings, ma'am. Okay, ma'am. Thank you for the cooperation, ma'am, in this assessment, ma'am. And I hope to see you again next time, ma'am. Thank you.
Thank you.